Hello and welcome to Our Ventura TV. I'm Sandra Siepak. On our show today, we'd like to welcome Fred Bauermeister. He is the Executive Director of the Free Clinic of Simi Valley. Thank you so much for joining us, Fred.
Thank you.
Glad to have you on the show.
Thank you.
I do want to talk a little bit about the Free Clinic of Simi Valley and get some more information for folks out there who may be interested in finding out a little bit more information on the clinic. Is it indeed a free clinic?
Yes.
Okay.
Anyone can come there and receive a service. There's no charge.
Okay.
We do ask for a donation. It's actually something that we fought for a long time, whether or not to ask for that donation or not.
Okay.
And we decided to do that, and it helped us because it brought in some cash, and it also brought the patient's involvement a little closer to their service need.
Okay.
So they buy in a little bit.
Right. Okay, so let's talk about the clinic, how it's structured, what you offer, and who's eligible to come to the clinic.
Yes.
So let's start off with, let's say someone is interested in coming to the clinic for services. How do they become eligible to come in and have services there?
My favorite part, Sandra.
Okay.
There are no eligibility requirements.
Nice. That's great.
Anyone can come there.
Okay. Now, do you need an appointment? Or,
Yes.
Oh, you do need an appointment?
Yes.
Okay.
It's a high demand for our services, and we schedule appointments for medical and dental and legal and counseling. All of them are by appointment.
So you do offer all those services for the Free Clinic of Simi Valley. And should somebody need legal information or dental, which is a big thing, they can come for any of those services.
Absolutely, and that's one of the beauties is that we have all these services basically in the same location. Our dental clinic is actually a few miles away from our main clinic site, which we're hoping to rectify, but it's all one patient and you're in one system.
Okay, so let's talk about how the services work.
Yes.
Is everyone licensed?
Yes.
Licensed healthcare professionals all come and work with you?
Yes.
Okay.
Right.
Are they volunteers or paid?
Right. We have 5 paid staff and 165 volunteer professionals. All the doctors, nurses, dentists, dental hygienists, lawyers, attorneys, marriage and family therapists, all volunteering their time through the generosity of their hearts to help others in need. And that's the beauty of what we do.
It is important. It's so important to many people out there.
Yes.
How does the Affordable Care Act play into coming to the clinic?
Well, as it was unfolding a few years ago, you know, we were quite curious as to what was going to happen to our patients, whether they were going to fold into the Affordable Care Act, covered California, and after the full implementation of the Affordable Care Act, we did notice a certain dip in our patient level, but after that, it just remained constant. So we have a little over 11,000 patient visits every year. And that's been since the Affordable Care Act implementation. Before that, we probably had 13 or 14,000 patient visits a year.
Okay. You see both children and adults?
Anyone.
Anyone. So no age limit?
No age limit.
Great. Very important. The clinic's mission is to provide medical care regardless of ability to pay.
Right.
So that is something that you have stuck with all these years.
Exactly.
And the clinic opened in 1971, correct?
That's correct.
Right. Okay. How are you funded? Because I'm sure this takes a great deal of money to keep the clinic up and running.
Actually, by comparison, it doesn't. Our annual operating budget, which mind you consists of 5 paid staff, 2 locations, and all the supplies necessary for 11,000 patient visits a year, is just about $350,000 a year. Okay. And when compared to other programs that are similar to what we do, in fact, I visited a clinic in Nevada last year, who had an annual operating budget of $2.5 million and had 11,000 patient visits. 2.5 million versus 350,000.
So you really stretch a dollar.
Yes.
That's wonderful.
Yes.
That's good. What are some of the types of things that people come in to see you for?
Sure.
Are they more medical, more legal?
No. Medical is probably what we're known for.
Right.
In fact, if you think of a free clinic, you probably think of medical.
Yes.
And so medical is our primary service area.
Okay.
And most people that come there now come for diabetes, hypertension, cholesterol issues, common health ailments, you know, flus and stuff like that. It's just that they can't afford to see a doctor elsewhere and they choose to come to us.
Okay. Should someone come to you and they need further testing, how
Yes.
does that work?
Well, we have great partnerships. One of them is Adventist Health Simi Valley.
Okay.
And Adventist Health Simi Valley does all of our lab work for all of our patients for free.
Nice. Very important.
Yeah. We estimate that at about a $400,000 contribution to the community.
Nice. Okay. What about legal services as well?
Legal services are provided by volunteer attorneys. Again, we have about a dozen of them. They specialize in family law.
Okay.
So people that have questions about divorce, child custody, you know, spousal support, anything like that.
Okay.
Our attorneys don't represent people, but they give them advice and information, can help them fill out forms. We have state-of-the-art computers and software that generate all the paperwork you need to, you know, modify your child custody or child support. We do some domestic, consumer stuff.
Okay.
And no criminal, really.
Okay.
We do have a little help with bankruptcy as well.
Okay. Now, on the dental programs,
Yes.
of course, dental work can be expensive.
Yes, it can.
So, how does that play in? Now, if someone comes and they need dental work,
Yes.
how does that work for them?
This is one of the most challenging parts of our 4 programs because dental is very complicated.
Yes.
I learned when we started the program about 15 years ago how complicated it was. But just in terms of sterilization, I always love talking about sterilization. You have 32 teeth in your mouth. Each of those teeth can have a variety of procedures. Each of those procedures has a number of instruments that have to be sterilized.
Right.
We're constantly sterilizing instruments so that we can keep patients safe, keep our providers safe.
Okay.
So starting there, then we can go out and do anything. We do extractions, x-rays, cleanings, fillings. We can do partials. We can do full dentures. We don't do anything cosmetic. We don't whiten teeth. We don't do braces.
Okay.
But we do everything else. And because it is so expensive
Yes.
and not covered by a lot of insurance programs, there's a high demand.
No,
so we get 5 calls for every 1 patient that we can see.
Wow.
So it's a real drain on us as far as are able to meet the need.
Right. Now, your dentists and assistants are all volunteers.
Yes.
Everybody's a volunteer.
Yeah, we have about 14 dentists. We offer dental services 5 days a week, Monday through Friday, starting at 8 a.m. and going until 2 p.m. Sometimes it goes into the evening, depending on the day or the day of the month.
Okay. Big question.
Yeah.
How can people come to the Simi Valley Clinic? Do you have to live in Ventura County? What if you live outside the county? How do you qualify to come to the clinic?
There are no qualifications.
So again, you can come from anywhere, even LA County.
Anyone can come.
Nice.
Anyone.
That's really important.
We just never wanted to be in that position of having...
Turning anybody away.
Well, that,
right.
Or having to make a judgment call.
Okay.
Sandra, should we let you come in or not?
Right.
Because you live, 2 blocks outside the proper zip code.
Right.
But you might have a strong need. It's worked out for us not to have to do that bureaucracy.
Okay.
Because of the fact, for example, with dental, that it's so hard to get in,
yes.
you must really want it or need it.
Right.
If you can be persistent and patient with us, we'll help you.
Right.
We're there to help you.
Right.
But just remember that we get so many calls.
When we talk about the clinic up and running and the funds that you do have, do you get help from the state, from the county, anybody?
No government money.
No government money.
It's all private.
Oh, it is?
So we're not affected by government shutdowns or any of that. It's all through private foundations.
Okay.
Livingston Memorial Foundation is a great partner of ours, and a Ventura County foundation.
Okay.
California Wellness. There's a whole bunch of them that help through the year.
Okay. You mentioned, of course, your organization really relies heavily on volunteers coming in.
Yes.
How would somebody become a volunteer with the free clinic?
One way is through our website, is just to reach us through info@clinicsv.com and state your interest in being a volunteer and what you might have to offer. We will reply. We reply to every inquiry about volunteering.
Right.
And we have a large number of folks that are just lay volunteers that just help.
Right.
And we provide some training to teach them, how to load a patient in a room and stuff like that.
Nice. Okay. How about age limit?
You got to be 16 or over.
16 or over,
Yeah.
okay. So you get some high school kids in there to
Yeah.
help as well.
Yeah. And we're happy to do that.
Yeah.
We, one of the beauties of our program is that it's a two-way street. We're not only providing a service to a person in need,
Yes.
but we're mentoring young people in the profession. To date, in fact, we have over 55 marriage and family therapists that have been trained through the Free Clinic of Simi Valley that are licensed in the state of California,
Right.
and about 65 physicians.
Okay. What about emergency services?
No.
No.
We're not
Okay.
an emergency clinic.
Okay. So you definitely need an appointment.
That's a technical difference.
Yes, it
Yeah.
is. Yes. But again, some people may want to come in.
If you're there, if you show up on our doorstep, if we can help you, we're going to help you. If
Okay.
we can't help you, we're going to call 911.
Absolutely. Let's have the website one more time so
It
we
is.
can let people know
Sure.
where to find you.
www.freeclinicsv.com. freeclinicsv.com.
Very good. And so you can also go to the website, learn more about the needs that you may have
Yes.
to come to the clinic.
Yes.
They will also give you hours and appointments,
Yes.
everything that you can get
Yes.
from the website.
Our phone number is 805-522-FREE, 3733.
Nice.
And if you call it, usually best to call after 5 p.m. And we can schedule an appointment for you for any of our services.
Okay. What is your hope for the future with the free clinic?
Well, we have a big plan. As I mentioned, our dental clinic is about 2 miles away from our main clinic site.
Okay.
We would like to bring our programs together in a single location.
Okay.
At the same time, we would like to bring a bunch of other nonprofit organizations with us into a single location and make a multi-services center.
Right.
Some other communities around Ventura County have such a program. So we're spearheading one in Simi Valley called the Free Clinic of Simi Valley Multi-Services Center. Our thanks to former Supervisor Peter Foy for his leadership, because he got us a 14,000 square foot building that is owned by the County of Ventura, and we're able to lease it for $1 a year, 14,000 square feet. The clinic will occupy about 7,000 square feet of that, and we'll have another 7,000
Well-used
for Big
space.
Brothers and Big Sisters.
Yeah,
And
that's
several
very,
other
very
nonprofits.
important. Very
Yeah.
important to so many people out
Yes.
there. And with so many people not having insurance and nowhere to go,
Yes.
this clinic makes all the difference.
Yes. It might be for a little while that you fall
Yep.
on hard times, and we're there for you.
That's great. Great to hear. Thank you so very much, Fred
Thank you,
Bauermeister,
Sandra.
the Executive Director of Free Clinic of Simi Valley. I'm so happy you joined us on the show today. We wish you all the best in the future for the clinic as well. Let's hope it grows even more.
Thank you very much.
Terrific. And thank all of you for joining us today on Our Ventura TV. I look forward to seeing you next time. I'm Sandra Siepak. Take care, everyone. Bye-bye.